The fluorescent lights of the Senate hearing room buzzed with a frequency that made Dr. Ethan Cross's teeth ache. He sat at the witness table, his hands pressed flat against the polished wood, fingers splayed exactly 3 inches apart. The pattern in the grain beneath his left palm formed a shape like a lung, bronchi spreading outward in fractal perfection. He counted the rings. 47. The tree had been 47 years old when it died. Senator William Hargrove leaned forward. Into his microphone, his voice cutting through the murmur of the gallery like a scalpel through flesh. Dr. Cross, I'm going to be direct with you. The American people deserve doctors they can trust, doctors who can connect with patients, doctors who understand the human element of medicine. Hargrove's eyes narrowed, his jaw set in that particular expression politicians wore when they believed they were defending something righteous. Your condition, this autism as you call it, how can we be certain it doesn't interfere with your judgment? How can a doctor who struggles to make eye contact, who reportedly has meltdowns in stressful situations, be trusted with human lives in critical moments? The room fell silent, except for the relentless hum of the lights. Ethan's colleague, Dr. Maya Richardson, shifted in her seat behind him, her breath catching in a way that suggested she wanted to intervene, but couldn't. The cameras lined against the back wall recorded everything, their red lights like tiny wounds in the darkness. Ethan felt the weight of 500 eyes pressing against his skin, each gaze a physical sensation like fingers prodding at his ribcage. He forced himself to look at Senator Hargrove's left eyebrow, a trick his therapist had taught him years ago. Not the eyes, never the eyes, but close enough that others couldn't tell the difference. "Senator," Ethan began, his voice steady despite the chaos building in his chest, "I don't struggle to make eye contact because I don't care about people. I struggle because I care too much. Every human face is a universe of micro-expressions, pupil dilations, muscle contractions. When I look at someone, I see everything. It's overwhelming. But that same ability to see patterns, to process information that others miss, that's what makes me good at what I do." Hargrove leaned back, unconvinced, his fingers steepled beneath his chin. "That's a lovely sentiment, Doctor. But this committee is investigating the death of Patricia Morrison, a woman who came to your hospital with what you diagnosed as anxiety. She died 3 hours later. Her family claims you missed obvious signs of a heart attack because you were too busy, and I quote, acting strange and avoiding normal conversation." The accusation hung in the air like smoke. Ethan's hands began to tremble, so he pressed them harder against the table until his knuckles whitened. The Patricia Morrison case. He had reviewed her chart 462 times in the past 3 weeks, every test, every vital sign, every word exchanged. She hadn't presented with typical heart attack symptoms, no chest pain radiating down the left arm, no diaphoresis, no sense of impending doom. Instead, she'd had jaw pain, nausea, and overwhelming fatigue. A typical presentation, more common in women. He'd ordered an EKG immediately, but the machine had malfunctioned. By the time a second machine arrived, 18 minutes had passed. 18 minutes that became the difference between life and death. "Senator, Mrs. Morrison presented with atypical symptoms," Ethan said, his voice gaining strength. "I recognized them immediately and ordered the appropriate tests. The delay wasn't due to my autism, it was due to equipment failure. The hospital's maintenance records show that the EKG machine in Bay 4 had been flagged for repair 2 weeks prior, but was never serviced. I filed a report about this the day after Mrs. Morrison died." Senator Hargrove shuffled papers, his expression darkening. Someone behind him whispered urgently, but he waved them away. "Be that as it may, Dr. Cross, the question remains. Can someone like you handle the pressure of emergency medicine? Can you be trusted when seconds matter?" Before Ethan could respond, the heavy oak doors at the back of the chamber burst open. A security guard rushed in, his face flushed, his radio crackling with urgent chatter. He moved directly to Senator Hargrove's aide, whispering something that made the young man's face go pale. The aide leaned down to Hargrove, cupping his hand over the senator's ear. Whatever he said made Hargrove's confident posture collapse like a building losing its foundation. The senator stood abruptly, his chair scraping against the floor with a sound that made Ethan flinch. "We're taking a recess," Hargrove announced, his voice tight. He pressed his hand against it, his chest, his face suddenly glistening with sweat. 15 minutes. But he didn't make it 3 steps before his knees buckled. The chamber erupted into chaos as Senator William Hargrove, the man who had just questioned whether an autistic doctor could be trusted in a crisis, collapsed onto the Senate floor, his body convulsing, his eyes rolling back into his skull. And Dr. Ethan Cross, the man whose competence had been on trial moments before, was already moving, his mind shifting, into the pattern recognition mode that made him both different and extraordinary, already seeing what no one else in that room could see. Ethan's body moved before his conscious mind fully processed the command. Years of emergency training had carved pathways in his brain deeper than any social anxiety or sensory overwhelm could block. He vaulted over the witness table, his dress shoes hitting the marble floor with a sharp crack that echoed through the suddenly silent chamber. Senator Hargrove lay on his back, his expensive suit jacket twisted beneath him, his face the color of old newspaper. His lips had taken on a bluish tint that Ethan's brain immediately catalogued as central cyanosis, indicating inadequate oxygenation of the blood. The senator's chest rose and fell in rapid, shallow movements, 36 breaths per minute, far above normal. Ethan dropped to his knees beside him, ignoring the cold of the marble seeping through his slacks. "Someone call 911, he commanded, his voice cutting through the paralyzed crowd. "Now!" His hands moved to Hargrove's neck, fingers pressing against the carotid artery. The pulse hammered against his fingertips, rapid and thready, approximately 140 beats per minute. Tachycardia. The senator's skin was cool and clammy, diaphoretic. Classic signs of shock, but what kind? Hypovolemic? Cardiogenic? Septic? Anaphylactic? Maya Richardson appeared at his side, her emergency medicine bag already open. She'd been prepared for anything except this. "Ethan, what do you need?" Her voice was steady, professional, the voice of someone who had worked alongside him for 3 years and trusted his judgment even when others didn't. "Stethoscope, BP cuff, pulse ox," Ethan said, his eyes scanning Hargrove's body with the intensity of a machine learning algorithm processing data. He noted the slight distension of the senator's abdomen, the way his right hand kept moving toward his lower back, even in his semi-conscious state, the faint yellow tinge to the whites of his eyes that became visible when Ethan gently lifted one eyelid. Not a heart attack, something else, something everyone was about to assume was cardiac, because that's what people always assumed when someone collapsed clutching their chest. Maya pressed the pulse oximeter onto Hargrove's finger while Ethan listened to his heart. The rhythm was fast but regular, no murmurs, no extra sounds, lungs clear bilaterally, no signs of pulmonary edema or pneumothorax. The pulse ox beeped to life, showing 89%, low but not critically so. Blood pressure 160/110, hypertensive, Security personnel formed a circle around them, keeping the growing crowd of senators, aides, and journalists at bay. Cameras flashed, creating bursts of light that felt like needles driving into Ethan's visual cortex. He squeezed his eyes shut for half a second, resetting, then refocused. Senator Hargrove's eyes fluttered open, unfocused, and dilated unevenly. The left pupil was slightly larger than the right, approximately 1 millimeter difference. Anisocoria. Could be benign, could be pathological. "Senator Hargrove, can you hear me?" Ethan asked, his face close to the senator's, close enough to smell the coffee on his breath and something else underneath it, something metallic and wrong. Hargrove's lips moved, but no sound emerged. His right hand clutched at Ethan's sleeve, fingers digging in with desperate strength. Then his back arched, his body going rigid, every muscle contracting simultaneously in a tonic seizure that lasted 8 seconds before releasing him back into semi-consciousness. "He's seizing," Maya said, already reaching for the Ativan in her bag. "No," Ethan said sharply, his hand stopping hers. "Not yet. This isn't epilepsy. Look at his abdomen." Maya's eyes followed his gaze. The distension was more pronounced now, the senator's belly tight and round beneath his white dress shirt. Ethan's fingers palpated the area with careful pressure, and Hargrove's entire body jerked in response, a whimper escaping his throat. "Acute abdomen," Maya whispered, understanding dawning in her eyes. "But the seizure?" "Not a seizure," Ethan said, his mind racing through diagnostic trees, branching possibilities narrowing with each new piece of data. "Decerebrate posturing, he's herniating, or he's about to." The paramedics burst through the doors with a stretcher and equipment, their boots thundering against the marble. The lead paramedic, a broad-shouldered man in his 40s, with Jenkins on his name tag, assessed the scene with practiced efficiency. "What do we have, Doc?" Jenkins asked, already moving to Ethan's side. "Male, approximately 60 years old, sudden collapse, tachycardic, hypertensive, showing signs of acute abdominal distress with altered mental status, and possible increased intracranial pressure," Ethan rattled off, his voice a monotone of clinical precision. "He needs a trauma center with neurosurgery and vascular surgery capabilities. St. Catherine's is closest. Tell them to prepare for possible emergency laparotomy and to have CT ready. This isn't cardiac, this is something else, something catastrophic, and we have maybe 30 minutes to figure out what before it kills him." Jenkins didn't question him, didn't hesitate. He'd seen enough emergencies to recognize the voice of someone who knew exactly what they were talking about. As they loaded Senator Hargrove onto the stretcher, the man who had questioned Ethan's fitness to practice medicine, Ethan made a decision that would either prove his brilliance or destroy what remained of his career. "I'm riding with him," Ethan announced. Maya grabbed his arm. "Ethan, you can't. You're a witness in a federal investigation. They'll say you're interfering, that you're trying to cover something up." Ethan looked at her, really looked at her, making eye contact for one of the rare times in his life because this mattered more than his discomfort. "He's going to die if someone doesn't figure this out, and right now, I'm the only one who sees it." The ambulance screamed through Washington, D.C. traffic, its siren a wailing banshee that made Ethan's jaw clench so hard he thought his molars might crack. He sat on the narrow bench beside Senator Hargrove's stretcher, his hands gripping the metal rail to keep steady as the vehicle swayed through turns. Every pothole sent a jolt up his spine that felt like electricity. The IV bag swung above Hargrove's head, the clear fluid catching the afternoon light filtering through the back windows. Jenkins worked with practiced efficiency, securing another IV line while his partner drove with controlled urgency. The cardiac monitor beeped steadily, each tone marking another heartbeat, another second of life, another moment closer to whatever catastrophe was building inside the senator's body. Hargrove's eyes were closed now, his face slack, his breathing supported by the oxygen mask covering his nose and mouth. The mask fogged with each exhale, a small reassurance that he was still alive, still fighting, even if he didn't know it. Ethan's mind worked through the differential diagnosis like a chess player seeing 12 moves ahead. The combination of symptoms didn't fit any common pattern. Acute abdomen with neurological symptoms, hypertension, the subtle jaundice. The back pain Hargrove kept reaching for before he lost consciousness. "What are you thinking, Doc?" Jenkins asked, his voice barely audible over the siren. "Because I've been doing this for 20 years and I've never seen anyone look at a patient the way you're looking at him." Ethan's eyes continued their systematic scan of Hargrove's body, noting the slight asymmetry in his abdomen, the way the right side appeared more distended than the left. His symptoms are progressing too fast for most common abdominal emergencies. Not appendicitis, the timeline's wrong. Not a typical bowel obstruction. The neurological involvement suggests something affecting both the abdomen and the brain, which means we're looking at either a systemic process or something that's causing secondary effects. Jenkins adjusted the oxygen flow. "Like what?" "Rupture," Ethan said, the word dropping into the space between them like a stone into still water. "Something ruptured or is about to rupture. The question is what?" He pulled out his phone, ignoring the 17 missed calls from hospital administration, and pulled up the Senate's Public Health Records database. As a federal employee, Senator Hargrove's basic medical information was accessible in emergencies. Ethan's fingers moved across the screen with rapid precision. Hypertension, controlled with medication. High cholesterol. Family history of cardiovascular disease. Father died of a stroke at 62, but there, buried in a note from a routine physical 6 months ago, a detail that made Ethan's breath catch. Abdominal ultrasound showed a 4.2 centimeter infrarenal aortic aneurysm. Patient counseled on monitoring, follow-up recommended in 3 months. 3 months. The follow-up would have been due 3 weeks ago. Had Hargrove gone? Ethan scrolled further. No record of a follow-up. Appointment. No additional imaging. Nothing. "He's got an abdominal aortic aneurysm," Ethan said, looking up at Jenkins. "And I think it's rupturing right now." Jenkins' face went pale. "Jesus, that's what, 80% mortality?" 90% if it ruptures completely, before we can get him to surgery," Ethan corrected, his voice devoid of emotion, because emotion was a luxury he couldn't afford when his brain needed to work at maximum capacity. "But that doesn't explain this neurological symptoms unless..." His mind raced through anatomical structures, blood flow patterns, the cascade of events that would follow if the aneurysm was leaking rather than completely ruptured. Blood in the retroperitoneal space, pressure on nerves. But the altered mental status, the decerebrate posturing, that suggested brain involvement. Unless the rupture was affecting blood flow to the spinal cord, causing referred pain and neurological symptoms that mimicked a brain bleed. Or unless there was a second aneurysm no one had detected. Some patients had multiple aneurysms, aneurysms in the brain, particularly in people with hypertension and connective tissue disorders. "Jenkins, call ahead," Ethan commanded, his voice sharp with urgency. "Tell them to have both neurosurgery and vascular surgery standing by, and tell them to prep for a CT angiogram of the chest, abdomen, and head. Full body scan. We might be dealing with multiple sites." The ambulance hit a bump that sent equipment rattling. Hargrove's body jerked with the impact, and fresh blood began seeping from his nose, dark and viscous. Ethan grabbed gauze, tilting the senator's head carefully, but his mind was cataloguing this new symptom with alarm: epistaxis, nosebleed. Combined with everything else, it suggested coagulopathy, a breakdown in the blood's ability to clot properly, disseminated intravascular coagulation, or simply the result of blood thinners Hargrove might have been taking for his cardiovascular disease. "What medications is he on?" Ethan asked Jenkins, who was already pulling up the information on his tablet. "Lisinopril for blood pressure, atorvastatin for cholesterol, and aspirin, 81 milligrams daily." Aspirin, an antiplatelet agent. If the aneurysm was leaking, the aspirin would make it harder for the body to form clots to seal the breach. Every drop of blood escaping into the abdominal cavity was blood his brain and organs weren't receiving. Every second counted, and they were stuck in traffic. Ethan could see the hospital now, St. Catherine's rising against the skyline just 8 blocks away, but between them and salvation sat a wall of cars that refused to part despite the ambulance's desperate wailing. "How much longer?" Ethan asked, knowing the answer would be too long, knowing that Senator Hargrove's life was measured now in minutes, knowing that the man who had questioned his competence was about to discover whether that competence was enough to save him. Jenkins leaned forward, speaking into the radio to his partner. "Take the shoulder, now!" The ambulance lurched onto the breakdown lane, accelerating past the gridlocked traffic. Hargrove's blood pressure alarm began to sound, the numbers dropping on the screen: 140 over 90, 130 over 85. The senator's body was going into shock as his cardiovascular system failed to maintain pressure, as blood leaked into spaces it was never meant to go, as his organs began to starve. "Come on," Ethan whispered, his hands gripping the rail so hard his fingers went numb. "Come on, Senator, don't you dare die, not like this, not before I prove you wrong." The ambulance swung into the emergency bay, tires squealing, and suddenly there were hands everywhere, people in scrubs pulling the stretcher out, voices calling orders, the controlled chaos of an emergency department receiving a critical patient. Dr. Patricia Chen, the trauma surgeon on duty, appeared at Ethan's side, her dark eyes sharp with focus. "What do we have, Cross?" she asked, and there was no judgment in her voice, no question about his competence, or his autism, or his right to be there. Just a doctor asking another doctor for the information she needed to save a life. And Ethan told her everything, his words precise and rapid, painting a picture of Senator William Hargrove's failing body with clinical clarity, while somewhere in the back of his mind he registered that this moment, this handoff of care from one physician to another, might be the last normal thing he did before everything fell apart. If you're gripping your seat right now, wondering if Senator Hargrove will survive, hit that like button and subscribe. Because this story is just getting started, and trust me, you don't want to miss what happens next. The CT scanner hummed with a deep mechanical rhythm that Ethan felt in his chest cavity, like standing too close to a subway train. He stood in the control room, separated from Senator Hargrove by reinforced glass and several feet of carefully calculated distance, watching as the machine's ring rotated around the senator's body, capturing cross-sectional images of every internal structure in slices thinner than a credit card. Dr. Chen stood beside him, her arms crossed, her eyes fixed on the monitors as the images began populating the screen. Each slice appeared like a photograph taken from inside Hargrove's body, grayscale anatomy laid bare for examination. Bones appeared white, soft tissue in varying shades of gray, blood vessels highlighted by the contrast dye pumping through the senator's cardiovascular system. "There," Ethan said, pointing at the monitor, before the radiologist could even begin their formal assessment. His finger touched the screen over a section of the abdominal aorta, the body's main artery, which should have appeared as a smooth, regular tube approximately 2 centimeters in diameter. Instead, it bulged outward like a balloon stretched too thin, the walls measuring nearly 6 centimeters across. But worse than the size was what surrounded it, a hazy, irregular cloud of increased density spreading into the retroperitoneal space. Blood. Leaked blood. The aneurysm hadn't fully ruptured yet, but it was leaking, and every heartbeat pushed more blood into places it didn't belong. Dr. Chen leaned forward, her breath fogging the monitor. 6 centimeters, that's a rupture waiting to happen. We need to get him to the OR immediately. Wait, Ethan said, his eyes still scanning the images as they continued to populate. Keep going. Run the head scan. Chen looked at him with confusion. Cross, we know what the problem is. Every second we waste is another second he bleeds out. We need to focus on the aneurysm. The neurological symptoms, Ethan insisted, his voice rising slightly, that edge of desperation creeping in that appeared when he knew something others didn't but couldn't quite articulate why he knew it. The decerebrate posturing, the altered mental status. It's too severe for just decreased perfusion from blood loss. There's something else. Chen hesitated, and in that hesitation, Ethan saw the calculation happening behind her eyes. Trust the autistic doctor with the strange insistence on unusual tests, or follow standard protocol and rush the patient to surgery? The head images began appearing on the adjacent monitor. Skull, brain tissue, ventricles, all the familiar structures Ethan had memorized in medical school and seen thousands of times since. The radiologist, Dr. Marcus Webb, a thin man with wire-rimmed glasses, adjusted the contrast and zoom level, moving through the images with practiced efficiency. Initial scan appears normal, Webb began. No signs of hemorrhage, no midline shift, no obvious masses or... He stopped, mid-sentence, his fingers freezing on the mouse. Wait, hold on. Ethan's heart rate, usually so controlled, kicked up several notches. He knew that tone. That was the tone of a doctor finding something unexpected and potentially catastrophic. Webb zoomed in on an area near the base of the brain where the cerebral arteries branched like trees. There, at the junction where the basilar artery split into the posterior cerebral arteries, a small bulge protruded from the vessel wall. It was tiny, barely 4 millimeters, but in neurovascular terms it might as well have been a ticking bomb. Basilar tip aneurysm, Webb said quietly, his voice carrying the weight of the implications. Unruptured, but given the patient's current hemodynamic instability and hypertension, it could blow at any moment. The room went silent, except for the ambient noise of medical equipment. Ethan felt vindication and horror in equal measure. He'd been right. There were multiple aneurysms, but being right meant Senator Hargrove's situation had just become exponentially more complex and deadly. Dr. Chen turned to face him fully, her expression a mixture of respect and concern. Cross, if we take him to surgery for the abdominal aneurysm, the blood pressure fluctuations, the anesthesia, the stress on his cardiovascular system could rupture the brain aneurysm, but if we don't fix the abdominal aneurysm immediately, he'll bleed out within hours. We have to do both, Ethan said, though even as the words left his mouth, he knew the impossibility of what he was suggesting. 2 major surgeries, 2 different surgical teams coordinating in a way that hospitals rarely attempted because the risk of complications multiplied exponentially. That's insane, Chen said, but her tone wasn't dismissive. It was the voice of someone considering an insane idea because all the sane ones led to death. We'd need neurosurgery and vascular surgery working simultaneously. The surgical time alone would be 6 to 8 hours. His body can't handle that kind of stress. The mortality rate would be astronomical. The mortality rate of doing nothing is 100%, Ethan countered, his voice flat. factual. And the mortality rate of fixing one and hoping the other doesn't rupture is maybe 70% for the abdominal aneurysm alone, but close to 90% if the brain aneurysm ruptures during or after surgery. The only chance he has, the only real chance, is fixing both problems at once. Dr. Gregory Hartman, the chief of neurosurgery, strode into the control room with the confidence of a man who had performed over 3,000 brain surgeries. He was in his late 50s, his grey hair cut military short, his eyes the pale blue of glacial ice. "Someone want to tell me why I'm being called in for a ruptured RA?" he asked, then stopped when he saw the brain scan on the monitor. "Oh, that's why." "Dr. Hartman," Chen began, "we have a unique situation. The patient has both a leaking abdominal aortic aneurysm and an unruptured basilar tip aneurysm. Dr. Cross is suggesting we repair both simultaneously." Hartman's eyes shifted to Ethan, assessing him with the same clinical precision Ethan used on patients. They'd never worked together directly, but Hartman's reputation preceded him. Brilliant, uncompromising, and notoriously difficult to convince when he thought an idea was wrong. "That's the most aggressive surgical approach I've heard suggested in a decade," Hartman said slowly. "It's also potentially the only thing that saves his life." He stepped closer to the monitor, studying the aneurysm with the intensity of a general studying a battlefield. "The location is terrible. Basilar tip. That's one of the most challenging approaches in neurosurgery. Deep, surrounded by critical structures. One wrong move, and he's dead or locked in. And you want me to do this while his belly is open and vascular is working on his aorta?" "Yes," Ethan said simply. Hartman turned to face him fully. "You're the autistic doctor." It wasn't a question, and there was no malice in the statement, just observation. "I am," Ethan confirmed, meeting his gaze for exactly 3 seconds before looking away. "I know what people think about that. Senator Hargrove made his thoughts very clear this morning, but that doesn't change what needs to happen. He has 2 aneurysms. Both are life-threatening. Both need to be fixed. And if we don't do them together, he won't survive one surgery long enough to have the second." Hartman was quiet for a long moment, his eyes moving between the scans and Ethan's face. Then, surprisingly, he smiled, a small expression that softened his severe features. "You know what I think? I think you see patterns other people miss. I think that's exactly the kind of mind we need in this room right now." He turned to Chen. "Patricia, call your rehab best vascular surgeon. Get the OR prepped for a combined approach. We're going to do something either brilliantly successful or spectacularly catastrophic." Chen pulled out her phone, already dialing. "You realize this patient is a United States senator. You realize that if this goes wrong, both of our careers are over. And Cross, you're not even supposed to be here. You're a witness in an investigation into this man's accusations against you." "I know," Ethan said quietly. "But he's also a human being, and human beings don't stop needing doctors just because they question those doctors' abilities." Hartman clapped him on the shoulder, a gesture that made Ethan flinch slightly at the unexpected contact, but he didn't pull away. "Well said. Now let's go prove to Senator Hargrove that the mind he questioned is the mind that saves his life, because if we pull this off, it'll be one for the medical journals." The operating room was a cathedral of controlled chaos, its bright lights casting everything in sharp relief, eliminating shadows and secrets, making every movement visible. Ethan stood in the scrub room adjacent to OR3, methodically washing his hands with the chlorhexidine solution, counting the strokes as he'd been taught in medical school. 20 strokes for each finger, 20 for the palm, 20 for the back of each hand. The routine was soothing, predictable, a moment of order before entering the storm. Through the window, he could see the surgical team assembling. Dr. Chen and her vascular team on one side, their instruments laid out in perfect rows, clamps, grafts, sutures, all the tools needed to repair a damaged aorta. Dr. Hartman and his neurosurgical team on the other side, their equipment even more delicate, microscopes, micro-instruments, aneurysm clips measuring millimeters. Between them, draped in sterile blue sheets, lay Senator William Hargrove. He'd been anesthetized, intubated, his life now sustained by machines that breathed for him and monitored every function of his faltering body. IVs ran from both arms, delivering a carefully calculated cocktail of medications designed to keep his blood pressure high enough to perfuse his organs, but low enough to minimize the risk of rupturing either aneurysm before the surgeons could reach them. Maya Richardson appeared beside Ethan, already gowned and gloved, her face barely visible behind her surgical mask and protective eyewear. "You know this is crazy, right?" she said, but her tone carried no judgment, only the concern of a friend. "I know," Ethan replied, rinsing his hands, watching the soapy water swirl down the drain. Each bubble was a tiny sphere catching the light, refracting it into rainbow patterns. He forced himself to look away before he got lost in the observation. "The hospital administrator is outside demanding to speak with you," Maya continued. "Something about liability and your ongoing investigation and how you have no business being in this OR. What did you tell them?" "I told them that Senator Hargrove is dying and the only doctor who connected the dots between his two aneurysms is you. And if they want to explain to the American public why they barred you from a surgery that could have saved a senator's life, that's their choice, but they better have their lawyers ready." Ethan felt something warm bloom in his chest, an emotion he struggled to name but recognized as gratitude. "Thank you." "Thank me by helping us save his life," Maya said. "Because if this works, you're going to be vindicated. And if it doesn't, we're all going down together." They entered the OR together, arms raised, hands dripping, moving to the sterile field where surgical nurses helped them into gowns and gloves with practiced efficiency. The smell of iodine and antiseptic filled Ethan's nose, too strong, almost overwhelming, but he breathed through it. He'd learned long ago that sensory overwhelm was something he had to manage, not something that could manage him. Dr. Hartman looked up from his position at the head of the table. "Dr. Cross, good of you to join us. You'll be assisting Dr. Chen with the abdominal repair. Your diagnostic work brought us here. You deserve to see it through." Ethan nodded, moving to Chen's side. She was already making the initial incision, a long midline cut from the sternum to the pubis, parting skin and fascia with smooth, confident strokes. The electrocautery hissed and smoked as it sealed small blood vessels, the smell of burning flesh adding to the sensory assault. But Ethan's mind was already compartmentalizing, filing away the distractions, focusing with laser precision on the task ahead. Chen's hands worked deeper through muscle layers approaching the peritoneum. "When we enter the abdominal cavity, we're going to see blood, probably a lot of it. The retroperitoneal space is going to be a mess. Our job is to find the aorta, control it above and below the aneurysm, and replace the damaged section with a synthetic graft. Simple in theory, complicated in practice," Ethan murmured, his eyes tracking her movements. He could see it in his mind, the three-dimensional anatomy laid out like a blueprint. The aorta ran down the center of the retroperitoneal space, behind the intestines and other organs, flanked by the inferior vena cava and surrounded by a network of smaller vessels and nerves. The aneurysm would have distorted normal anatomy, making landmarks harder to identify. And the leaked blood would obscure visibility, turning the surgical field into a crimson swamp where one wrong cut could sever something vital. Chen entered the peritoneum, and immediately dark blood welled up into the incision, exactly as she'd predicted. The suction device whined as the scrub nurse removed it, but more blood replaced it almost instantly. The senator was bleeding internally, steadily, relentlessly. "Pressure's dropping," the anesthesiologist called out from his station at the head of the table. "BP 90/60, heart rate 150. "Hang 2 more units of blood," Chen ordered, her voice calm despite the urgency. "And increase the pressors. We need to maintain perfusion, but keep the systolic under 120 for Hartmann's team." At the other end of the table, Hartmann was preparing for his own battle. The senator's head was immobilized in a Mayfield clamp, 3 pins holding his skull in perfect position. Hartmann had already shaved and prepped the surgical site, marking the planned craniotomy location with a sterile marker. He would remove a section of skull, peel back the layers of dura and arachnoid membrane, navigate through the folded terrain of the brain itself to reach the aneurysm hiding at the base. "We need to sequence this carefully," Hartmann said, his voice projecting across the OR. "Patricia, how long until you have proximal control of the aorta?" Chen's hands moved with swift precision, dissecting through retroperitoneal tissue, following the path toward the aorta by feel and memory as much as sight. 15 minutes to get there, another 10 to place clamps, 25 minutes total. That works. I need 30 minutes to open and navigate to the aneurysm. We'll time it so we're both ready to make our definitive repairs simultaneously. That minimizes the time either aneurysm is under maximum stress. It was like choreographing a ballet where every step had to be perfect, or the dancer died. Ethan watched Chen's hands, but his mind was also tracking Hartmann's progress in his peripheral vision, his brain processing 2 complex surgeries simultaneously. Most doctors found it difficult to think about one surgery at a time. Ethan found it difficult not to think about everything at once. Chen's fingers closed around the aorta above the aneurysm, the vessel pulsing weakly against her palm. "Found it. Jesus, this thing is ready to blow. The wall is paper thin." She looked at Ethan. "Place the proximal clamp, carefully." Ethan took the vascular clamp from the scrub nurse, feeling its weight, its perfectly engineered spring tension designed to stop blood flow without crushing the vessel. His hands moved to the aorta, positioning the clamp precisely 3 centimeters above the aneurysm's upper margin. He released the handles slowly, watching the metal jaws close around the pulsing artery until blood flow ceased distal to the clamp. 1 step done, 1,000 more to go, and across the table, through the organized chaos of 2 surgical teams working in impossible synchronization, Senator William Hargrove's body lay suspended between life and death, his fate resting in the hands of doctors he'd never fully trusted, especially the one he'd publicly questioned just hours before, the one whose different mind was now his only hope. Time moved differently in the operating room. Minutes stretched into hours, hours compressed into moments, all of it measured by the rhythmic beeping of monitors and the controlled urgency of surgical hands moving through human tissue. Ethan's world narrowed to the field of vision before him. The exposed abdominal aorta, its aneurysmal bulge now fully visible, the walls so thin he could see the dark blood swirling inside like wine in a glass bottle. One wrong move, one moment of excessive pressure, and the entire structure would rupture, flooding the surgical field with blood faster than they could possibly control it. Dr. Chen worked with the focused intensity of a bomb technician defusing an explosive device. Her hands moved in millimeter increments, dissecting away the adhesions and scar tissue that bound the aneurysm to surrounding structures. Every few seconds, she paused, allowing the scrub nurse to suction away blood and fluid, clearing her view. Distal clamp. "Ready?" Chen asked, her voice muffled by her mask, but clear enough. Ethan positioned the second vascular clamp below the aneurysm, at the level where the aorta bifurcated into the iliac arteries that supplied blood to the legs. His hands were steady despite the knowledge that Senator Hargrove's life literally rested in his palms. He'd performed this maneuver dozens of times in his residency and fellowship, but never on someone who'd accused him of being incompetent. Never on someone whose death would be seen as vindication of those accusations. "Clamp in place," Ethan confirmed, releasing the handles and watching the metal jaws bite into the arterial wall with calculated pressure. Enough to stop flow, not enough to damage the vessel. With both clamps in place, the aneurysm was now isolated from the rest of the circulatory system. Blood pressure distal to the repair site dropped to 0. The senator's legs would receive no blood flow until they restored continuity. But that was the necessary sacrifice. Better temporary ischemia than death from hemorrhage. Chen picked up a scalpel, the blade catching the overhead lights. "Opening the aneurysm now, suction ready. Cross, if I nick the posterior wall and hit the vena cava, we're going to have about 30 seconds to control it before he bleeds out. Watch for any abnormal bleeding." Ethan's eyes never left the surgical field as Chen made a longitudinal incision along the aneurysm's anterior wall. Dark, clotted blood spilled out, the consistency of jelly, the remnants of old hemorrhages and thrombus formation that had accumulated over months or years as the aneurysm slowly expanded. The suction whined, removing the debris, revealing the interior of the aortic wall. It looked like tissue paper, translucent and fragile, striations visible where the media layer had degraded, atherosclerotic plaques crusted along portions of the wall, yellow-white deposits of cholesterol and calcium that had accumulated over decades of high blood pressure and high cholesterol. This was what happened when the body's infrastructure failed, when the pipes meant to carry life-giving blood became compromised by time and disease. "Starting to place the graft," Chen announced. She held up the synthetic tube, a woven polyester construct that would serve as the new aorta, bypassing the damaged segment entirely. It was approximately 20 centimeters long, sized to match the senator's anatomy based on preoperative measurements. With practiced precision, she began suturing the graft to the healthy aorta above the aneurysm using a running stitch of non-absorbable suture. Each bite of the needle had to catch enough tissue to hold securely, but not so much that it tore through the fragile vessel wall. It was like sewing wet tissue paper, requiring a delicate balance of tension and technique. Meanwhile, at the head of the table, Dr. Hartman had completed his craniotomy. A section of the senator's skull now sat in a sterile basin, labeled and preserved for replacement at the end of the procedure. The brain itself was visible, pale pink-grey tissue, glistening under the surgical lights, its surface traced with blood vessels that pulsed with each heartbeat. Hartman worked under the operating microscope now, his movements translated through mechanical arms that dampened any tremor, any imperfection in human motion. He was navigating through the sylvian fissure, the natural cleft between the frontal and temporal lobes, heading deep toward the base of the brain where the basilar artery resided. "Visual on the basilar tip," Hartman reported, his voice steady despite the complexity of what he was seeing. "The aneurysm is right where the imaging showed it, approximately 4 millimeters, small but in a terrible location. I'm going to need perfect hemodynamic stability when I clip it. Any pressure surge could rupture it before I get the clip in place." The anesthesiologist adjusted his medications, fine-tuning blood pressure and heart rate with the precision of a sound engineer mixing a recording. BP stable at 100/65, heart rate 80. You've got a 5-minute window before I need to adjust again." 5 minutes is all I need, Hartman said, though everyone in the room knew that 5 minutes in neurosurgery could feel like 5 hours or 5 seconds, depending on what went wrong. He continued his dissection, separating the aneurysm from the surrounding perforating arteries, tiny vessels no thicker than thread that supplied blood to critical brain structures. Nick, one of those, and the senator could wake up with a stroke. Leave one trapped when the clip closed, and the result would be the same. This was surgery at the edge of human capability, where the margin for error was measured in fractions of millimeters. Back in the abdomen, Chen was completing her proximal anastomosis, the connection between the graft and the upper aorta. "Proximal connection complete," she announced. "Moving to the distal end. Cross, retract the small bowel. I need better exposure of the iliac bifurcation." Ethan took the retractor, a metal instrument shaped like a right angle, and carefully lifted the loops of intestine out of the surgical field, exposing the lower end of the aneurysm and the bifurcation beyond. His mind processed the three-dimensional anatomy, understanding that beneath the tissue he could see lay structures he couldn't: the ureters carrying urine from kidneys to bladder, the inferior mesenteric artery supplying the left colon, the autonomic nerve plexus responsible for sexual function. Damage any of those, and the senator's life might be saved, but his quality of life destroyed. Chen began the distal anastomosis, connecting the graft to the iliac arteries. This was technically more challenging because she had to create a Y-shaped connection, one branch of the graft going to each leg. The suturing had to be perfect, creating a watertight seal that would hold against arterial pressures of 120 millimeters of mercury or higher. One leak, one area of weakness, and they'd be back in surgery within days or weeks, assuming the patient survived. "Distal anastomosis complete," Chen said after what felt like an eternity, but was actually 23 minutes. "Ready to restore flow. Hartman, what's your status?" "Aneurysm isolated," Hartman replied, his voice tight with concentration. "I've got the clip positioned. I need 30 seconds to deploy it, then another minute to verify I haven't trapped any perforators. Can you give me 2 minutes before you release your clamps?" "Affirmative. 2 minutes." The OR fell into a tense silence, broken only by the ventilator's rhythmic hiss and the monitor's steady beeping. This was the moment of maximum danger, where both aneurysms were at their most vulnerable, where the choreography they'd planned would either work perfectly or fail catastrophically. Ethan watched Hartman's hands through the microscope's video feed displayed on a monitor. The neurosurgeon's instruments moved with infinitesimal precision, positioning a titanium aneurysm clip across the neck of the bulge, preparing to shut it off from the circulation permanently. The clip looked like a tiny clothespin, its spring-loaded jaws designed to close with exactly enough pressure to seal the aneurysm without rupturing it. "Deploying clip," Hartman said. His hand squeezed the applicator, and on the monitor, Ethan watched the clip close across the aneurysm's neck. The bulge collapsed slightly, its pulsation ceasing as blood flow stopped reaching it. Hartman spent the next minute examining every millimeter of surrounding tissue, verifying that no critical vessels had been compromised. "Clip is good, all perforators patent. The aneurysm is secured." Chen looked at Ethan. "Release the distal clamp first, slowly." Ethan's hands moved to the clamp controlling blood flow to the senator's legs. He began releasing it incrementally, allowing blood to flow back into the graft and the lower body. The graft pulsed, filling with blood, the suture lines holding. No leaks, no bleeding. "Distal flow restored," Ethan reported. "Now the proximal clamp," Chen ordered. This was the final test. When they released the proximal clamp, full arterial pressure would return to the graft and the repair site. If the anastomoses weren't perfect, if the sutures had any weakness, blood would burst through with catastrophic force. Ethan released the proximal clamp. Blood surged into the graft. The entire construct pulsed with restored flow. The suture lines held. Perfect, watertight, life-sustaining. Flow restored, Chen said, and for the first time in hours, Ethan heard relief in her voice. Repair is complete and holding, no leaks, strong distal pulses in both iliac arteries. Around the OR, collective tension released like a held breath finally exhaled. The scrub nurses relaxed slightly. The anesthesiologist smiled behind his mask. And Ethan felt something he rarely allowed himself to feel. Pride. They'd done it. Against impossible odds, they'd repaired both aneurysms simultaneously. Senator William Hargrove was alive, his circulatory system restored, his brain aneurysm secured. The man who had questioned whether an autistic doctor could handle pressure, whether different thinking was compatible with medical excellence, had just had his life saved by exactly that kind of mind, working in concert with other brilliant minds. But as the euphoria of surgical success began to fade, replaced by the meticulous work of closing and finishing, Ethan realized that saving the senator's life was only the first challenge. The harder challenge would come when Hargrove woke up and had to face what had happened, who had saved him, and what that meant for everything he believed about competence and capability, and the different ways human minds could achieve extraordinary things. The ICU was quieter than the OR, but no less intense. Senator William Hargrove lay in bed 3, surrounded by machines that breathed for him, monitored him, fed him medications through precisely calibrated IV pumps. The ventilator hissed in its rhythmic cycle, 16 breaths per minute, the tube down his throat connected to his lungs, maintaining his oxygenation while his brain recovered from the trauma of surgery. His head was wrapped in white gauze, covering the craniotomy site where Dr. Hartman had temporarily removed a section of skull to access the aneurysm. That piece of bone would be replaced in a second surgery once the swelling decreased, typically 7 to 10 days post-operation. For now, that portion of his skull was absent, leaving the brain protected only by scalp and dressing, vulnerable in a way that made even experienced medical staff uncomfortable. Ethan stood at the nurse's station, reviewing the post-operative orders he'd written, checking and rechecking each medication dose, each parameter, each instruction. His shift had officially ended 4 hours ago, but he couldn't leave, not yet. Not until he knew the senator was stable, that their surgical triumph wasn't going to be undone by post-operative complications. Maya Richardson approached with 2 cups of coffee, pressing one into his hand. "You need to sleep, Ethan. You've been awake for 23 hours. "Sleep is inefficient right now," Ethan replied, his eyes scanning the flow sheet that tracked every aspect of Hargrove's physiology. Heart rate, blood pressure, oxygen saturation, intracranial pressure, urine output, all the data points that told the story of a body trying to heal. His ICP is rising. It's up to 18. Normal is under 15. Maya looked at the monitor, displaying the intracranial pressure reading from the bolt that had been placed in Hargrove's skull during surgery. 18 millimeters of mercury. Not critical yet, but trending in the wrong direction. Rising pressure inside the skull could indicate bleeding, swelling, or other complications that could damage the brain even after the aneurysm was successfully clipped. "He's on mannitol and hypertonic saline," Maya noted, reading the medication list. "We're doing everything we can to reduce the swelling." "It's not enough,"
Ethan said, his mind already racing through the differential diagnosis. Something's wrong. The pressure shouldn't be rising this fast this soon after surgery. He moved to the bedside, his eyes examining the senator with systematic thoroughness. Hargrove's pupils were equal and reactive to light, 3 millimeters each, constricting appropriately when Ethan shone his pen light into them. No signs of herniation, the catastrophic condition where rising pressure forces brain
Tissue through openings in the skull, causing irreversible damage. But the early warning signs were there for those trained to see them. The ventilator alarm began to sound, a sharp electronic tone that cut through the ambient noise of the ICU. Ethan's eyes snapped to the display, peak airway pressure rising. The machine was having to work harder to deliver each breath, meeting increased resistance in Hargrove's lungs. Respiratory distress, Ethan said, already reaching for them, stethoscope hanging around his neck. He pressed it against Hargrove's chest, listening to the breath sounds. The right lung sounded clear, air moving in and out with each ventilator cycle. But the left lung was diminished, the sounds muffled, as if something was preventing the lung from fully expanding. Maya was already pulling up the portable chest X-ray machine, the large mobile unit that allowed imaging at the bedside. Within 3 minutes, they had an image displayed on the
monitor. Ethan's suspicion was confirmed. The left lung field appeared whiter than it should, a hazy opacity spreading across the lower lobe. Fluid, blood, a hemothorax, blood collecting in the pleural space between the lung and the chest wall, compressing the lung and preventing it from expanding properly. "He's bleeding into his chest," Ethan said, his voice tight with controlled alarm. "From where? The surgery was abdominal and cranial. We were nowhere near his chest." Maya was
already paging the surgical team, but her question hung in the air. This shouldn't be happening. Then Ethan remembered something from the preoperative workup, a detail he'd noted and filed away, but hadn't had time to fully investigate during the emergency. "Pull up his full medical history," Ethan commanded, moving to the computer terminal. "Everything, every hospital visit, every medication, every diagnosis." Maya's fingers flew across the keyboard, pulling up years of records. "What
are you looking for?" "A reason someone with multiple aneurysms would spontaneously bleed post-operatively," Ethan said, his eyes scanning through the data at a speed that would seem impossible to someone who didn't understand how his brain processed information. Patterns. He was looking for patterns, and there, buried in records from 3 years ago, a rheumatology consultation. The senator had been evaluated for joint pain and fatigue. The workup had included a genetic panel. 1.
Result had come back positive, a mutation in the COL3A1 gene, the gene responsible for producing type 3 collagen, a critical structural protein in blood vessels, organs, and skin. The diagnosis noted but not prominently flagged, suspected vascular Ehlers-Danlos syndrome, a connective tissue disorder that caused fragile blood vessels, organs, and tissues. Patients with VEDS were at risk for spontaneous arterial rupture, organ rupture, and yes, multiple aneurysms. "He has vascular
Ehlers-Danlos syndrome," Ethan said, the pieces clicking together in his mind. "His connective tissue is fragile. The stress of surgery, the blood pressure fluctuations, they could have caused a spontaneous tear in one of his intercostal arteries or internal mammary vessels. He's bleeding from a vessel that just gave out." Dr. Chen appeared at the bedside, still in scrubs, her face drawn with fatigue, but alert with the adrenaline of a new crisis. "Talk to me, Cross. What do we have?"
Ethan explained rapidly, pointing to the X-ray, the medical history, the genetic diagnosis. Chen's expression darkened as she processed the information. "If he has VEDS, we should have known before surgery. His vessels could tear under normal surgical manipulation. We could have caused multiple bleeding sites. The diagnosis was buried in his records, Ethan said. The senator probably didn't even know the full implications. Many patients with suspected VEDS never get confirmed. They just live with it, never realizing how fragile they are until something catastrophic happens. Well, something catastrophic is happening right now, Chen said, examining the X-ray. That's at least 500 milliliters of blood in his chest, and it's accumulating. We need to place a chest tube to drain it, and we need to find the bleeding vessel and repair it before he exsanguinates. Exsanguination, death by blood loss. The word hung in the air like a threat. They'd saved the senator from 2 aneurysms only to have his own body betray him in a different way, the genetic lottery of vascular fragility coming due at the worst possible moment. Get a chest tube kit, Chen ordered the ICU nurse, and call OR. Tell them we need a room immediately. We're going back in. Ethan felt the weight of exhaustion pressing down on him. 23 hours without sleep, his sensory filters worn thin, every sound and light and smell too intense. But he also felt the crystalline clarity that came when his mind locked onto a problem, when the pattern recognition that made him different became the scalpel that cut through medical uncertainty. "I'm coming with you," Ethan said. Chen didn't argue. "We're going to save his life again, as many times as it takes." She looked at him with an expression that contained respect, concern, and something else, something that might have been admiration. "You don't give up, do you?" "No," Ethan said simply. "I don't." They wheeled Senator Hargrove back toward the OR, his body surrounded by portable monitors and equipment, his life sustained by machines and medications, and the determination of doctors who refused to let complexity or difficulty or impossible odds be the reason someone died. And as the OR doors swung open once more, Ethan realized that this was what medicine really was. Not just the dramatic saves, not just the impossible surgeries, but the relentless refusal to accept defeat, the grinding commitment to fighting for every patient, even the ones who questioned you, even the ones who doubted you, even the ones who didn't understand that different minds could be exactly what medicine needed. The second surgery was faster than the first, but no less tense. Dr. Chen made a thoracotomy incision between the senator's ribs, spreading them with a rib spreader that opened the chest cavity like parting curtains on a stage. Blood welled up immediately, dark and viscous, confirming what they'd suspected. Somewhere in the intricate network of vessels supplying the chest wall, something had torn. The suction whined continuously as they removed the accumulated blood, searching for the source. Ethan stood across from Chen, retracting tissue, his eyes scanning the surgical field with intense focus. The intercostal arteries ran along the underside of each rib, small but capable of significant bleeding if damaged. In a patient with normal connective tissue, they were robust and resilient. In a patient with vascular Ehlers-Danlos syndrome, they were fragile as wet paper. "There," Chen said, pointing with her forceps. A small arterial branch was oozing blood, not spurting with the force of a major laceration, but leaking steadily, enough to accumulate hundreds of milliliters over hours. She applied a clip to the vessel, stopping the flow, then placed a suture ligature to ensure it stayed closed. "That's the primary source," she said, "but I'm seeing other areas that look concerning. The tissue here is unusually friable. It tears when I touch it." That was the insidious nature of VEDS. Every vessel was a potential weak point. Every surgical manipulation risked creating new tears. They were fighting the senator's own genetics, trying to repair damage faster than his body could create new problems. After 45 minutes, Chen was satisfied she'd identified and controlled all active bleeding sources. They closed the chest, leaving a drain in place to monitor for reaccumulation of blood. When they finally wheeled Hargrove back to the ICU, Ethan felt like he'd aged a year in a single night. It was 6:47 a.m. Sunlight was beginning to stream through the hospital windows, painting everything in shades of gold and amber. The morning shift was arriving, fresh and alert, while Ethan felt like he was moving through water, every motion requiring conscious effort. "Go home, Cross," Dr. Chen said, pulling off her surgical cap. "You've been here for 27 hours straight. You've done everything humanly possible. The rest is up to him and time." But as Ethan prepared to leave, as he changed out of his scrubs and back into the suit he'd worn to the Senate hearing a lifetime ago, he received a page from the ICU. Senator Hargrove was waking up. Against all odds, despite 2 major surgeries and a spontaneous hemorrhagic complication, William Hargrove's brain was emerging from sedation, his eyes beginning to flutter, his hands starting to move in response to commands. Ethan returned to the ICU, fatigue forgotten, replaced by a different kind of energy. The senator was being extubated, the breathing tube removed from his throat now that he could breathe on his own. He coughed, gagged, his face contorting with discomfort. Then slowly, his eyes opened. They were confused at first, unfocused, trying to make sense of the world. Then gradually, awareness returned. Hargrove looked around at the monitors, the IV lines, the bandages on his abdomen and head. His hand moved to his skull, feeling the gauze there, the absence of bone beneath it. "Don't touch," the ICU nurse said gently, guiding his hand away. "You've had surgery. You're in the ICU at St. Catherine's Hospital." Hargrove's eyes found her face, then swept the room, landing finally on Ethan, who stood at the foot of the bed. Recognition dawned slowly, memory returning in fragments. The Senate hearing. The questions about competence, the sudden pain, the collapse. "You," Hargrove whispered, his voice hoarse from the breathing tube. "You're the doctor, the one I—" He didn't finish the sentence, but he didn't need to. The memory hung between them, unspoken, but understood. Dr. Chen stepped forward. "Senator Hargrove, I'm Dr. Patricia Chen, the trauma surgeon who operated on you. You had 2 life-threatening aneurysms, one in your abdomen, one in your brain. Dr. Cross identified both and coordinated your care. Without his intervention, you wouldn't have survived." Hargrove's eyes returned to Ethan, studying him with an intensity that felt uncomfortable. Ethan forced himself to maintain eye contact for 3 seconds before looking away at the monitor displaying the senator's vital signs. Heart rate 92, blood pressure stable, oxygen saturation 97% on room air. Numbers were easier than eyes. "I questioned your competence," Hargrove said quietly. "In front of the entire country. I suggested you weren't fit to practice medicine." "Yes," Ethan said simply, because there was no point in denying what had happened. "But you were also dying, and doctors don't get to choose which patients they save based on whether those patients respect them." Hargrove was silent for a long moment. When he spoke again, his voice carried a weight it hadn't held before, the weight of someone confronting their own prejudice and finding it wanting. "I was wrong." Those 3 words, simple but profound, seemed to cost him something to say, as if admitting error required more courage than he'd had to muster in a long time. "I was wrong about you, about what autism means, about what makes someone capable of being a doctor. I made assumptions based on ignorance and bias." Ethan felt something shift in his chest, a loosening of tension he hadn't realized he was carrying. "People often do," he said. "They see someone who doesn't make eye contact, who struggles with social cues, who processes information differently, and they assume incompetence, but different doesn't mean less. Sometimes it means more. Sometimes seeing patterns others miss, thinking in ways others don't, that's exactly what's needed." Maya Richardson, who had been standing in the doorway, moved into the room. "Senator, the Patricia Morrison case that prompted your investigation, we've received the full equipment failure report. The EKG machine malfunction was documented by 3 separate staff members. Dr. Cross's handling of the case was not just appropriate, it was exemplary. He recognized atypical presentation, ordered the correct tests immediately, and when the equipment failed, he advocated for the patient until a working machine was found. The delay cost Mrs. Morrison her life, but the delay wasn't caused by Dr. Cross. It was caused by a hospital that failed to maintain its equipment, despite repeated warnings. Your investigation should be focusing on systemic failures, not individual physicians, especially not physicians whose only crime was being different." Hargrove closed his eyes, processing this information. "I can't bring her back, I can't undo the investigation, but I can make sure the focus shifts to where it belongs. And I can make sure people know what really happened here, what you did for me, what this says about the assumptions we make about people we don't understand." He opened his eyes again, looking directly at Ethan. "I'm going to make a statement when I'm discharged. I'm going to tell people that the doctor I questioned saved my life, that the mind I doubted was the mind that saw what no one else saw. And I'm going to fight to make sure doctors like you are valued, not questioned, because this country needs more doctors who see patterns, not fewer." Ethan nodded slowly. "Thank you, Senator. But I didn't save your life to change your
mind about autism or about me. I saved your life because that's what doctors do. It's what we're supposed to do. Every time, for everyone, regardless." The ICU settled into a quiet rhythm. The crisis past, the future uncertain, but at least present. Senator Hargrove would spend weeks recovering, undergoing rehabilitation for the surgery, managing the complications of vascular Ehlers-Danlos syndrome. His life would never be the same, but he would have a life, and that mattered. Ethan
finally allowed himself to leave, to walk out of the hospital into the morning sunlight, his body exhausted, but his mind finally quiet. He'd proven something to the senator, to himself, to everyone who had ever questioned whether his way of thinking was compatible with medicine. But more than that, he'd simply done what he'd been trained to do, what his particular brain was especially good at doing, seeing the patterns in chaos, finding the path through impossible complexity, refusing to give up when giving up would have been easier. As he stood on the sidewalk outside St. Catherine's, the city coming to life around him, Ethan allowed himself a small smile. Different wasn't less, different was just different, and sometimes different was exactly what someone needed to survive. If this story is hitting you in the feels, if you're seeing autism in a new light, if you believe in doctors like Ethan, drop a comment below telling me what you think. Share this with someone who needs to hear it. And hit that subscribe button, because stories like this, stories about brilliant minds saving lives despite the odds, that's what this channel is all about. 3 weeks later, Ethan sat once again in a Senate hearing room, but this time the atmosphere was different. The hostility that had permeated the previous hearing was absent, replaced by something that felt like anticipation. Senator Hargrove sat at the committee table, his head still wrapped in bandages, though his craniotomy had been successfully repaired 2 days prior. He'd insisted on returning to work despite his doctor's recommendations for extended rest, driven by what he said was a moral obligation to correct the record. The gallery was packed. News cameras lined the back wall. This hearing had been called specifically to address the findings of the investigation into Patricia Morrison's death and to discuss the broader implications for how medical competence was assessed and valued. Senator Hargrove leaned forward into his microphone, his voice steady but carrying an undertone of emotion that hadn't been present before. This committee convened 3 weeks ago to investigate the death of Patricia Morrison and to question whether Dr. Ethan Cross was fit to practice emergency medicine. I was the primary advocate for that investigation. I was convinced that Dr. Cross's autism represented a liability, a weakness that put patients at risk. He paused, his hand unconsciously moving to touch the bandage on his head. I was wrong, catastrophically, shamefully wrong, and I'm here today to make that clear to everyone watching. A murmur ran through the gallery. Hargrove continued. The investigation has concluded that Mrs. Morrison's death was the result of equipment failure and systemic hospital inadequacies, not physician error. Dr. Cross's diagnosis was correct. His treatment plan was appropriate. The delay that proved fatal was caused by a malfunctioning EKG machine that should have been repaired weeks before Mrs. Morrison ever walked through the door. Dr. Cross did everything right. The system failed both him and his patient. He pulled out a document, holding it up for the cameras. This is the hospital maintenance log showing that the EKG machine in question had been flagged for repair 17 days before Mrs. Morrison's visit. It was never serviced. That's a hospital administration failure, not a physician failure.
And it's unconscionable that we blamed a doctor for a broken system. Ethan sat quietly, his hands folded in his lap, his eyes focused on a point just past Hargrove's left shoulder. He'd known the investigation had cleared him, but hearing it announced publicly, hearing the accusations that had haunted him for weeks being dismantled piece by piece, created a sense of relief he hadn't known he needed. Hargrove set the document down and looked directly at Ethan. But more than that, I
need to address what happened 3 weeks ago. As everyone in this room knows, I collapsed during the previous hearing. I was diagnosed with 2 separate, life-threatening aneurysms. The doctors told me later that if both hadn't been identified and repaired simultaneously, I would have died. Dr. Cross identified both aneurysms. Dr. Cross coordinated my care. Dr. Cross was present in the operating room when my life was saved. He paused, his voice thickening with emotion. The man I questioned saved my life. The mind I doubted saw patterns my other doctors missed. The person I suggested was unfit to practice medicine proved more capable, more brilliant, more dedicated than I ever gave him credit for. Senator Margaret Whitmore, who chaired the committee, spoke up. Senator Hargrove, are you suggesting that we need to reconsider how we evaluate medical professionals, particularly those with neurodevelopmental differences? I'm not just suggesting it, Margaret, Hargrove said firmly. I'm demanding it. We've been operating under an outdated model that assumes competence looks one way, acts one way, thinks one way. We've been filtering out brilliant people because they don't make eye contact or because they process social cues differently or because they experience sensory input more intensely. And in doing so, we're depriving patients of doctors who might see what others miss, who might save lives that would otherwise be lost. He gestured toward Ethan. Dr. Cross thinks differently, yes. He experiences the world differently, yes. But those differences are strengths, not weaknesses. His ability to recognize patterns, to process complex information rapidly, to hyper-focus on diagnostic details, those are exactly the traits we should want in our emergency physicians. Instead, we've questioned him, investigated him, made him prove his worth over and over in ways we would never demand of neurotypical physicians. Dr. Meyer Richardson, who had been called to testify, stood to speak. "If I may add something, Senator Whitmore?" "Please," Whitmore said, nodding. "I've worked alongside Dr. Cross for 3 years," Meyer began, her voice clear and confident. "I've seen him diagnose conditions other physicians missed. I've watched him remain calm in crisis situations that would overwhelm most people. Yes, he sometimes needs accommodations. He wears noise-cancelling headphones during breaks because the ambient sound of the emergency department is overwhelming for him. He sometimes needs a quiet space to decompress after particularly intense shifts. He communicates better via written notes than extended verbal conversations in some contexts." She paused, looking around the room. "But these are minor accommodations that allow him to perform at an extraordinary level. We accommodate physicians who wear glasses because we understand that correcting vision allows them to do their job better. We accommodate physicians who are left-handed by providing left-handed instruments. Accommodating neurodivergent physicians is no different. It's about allowing everyone to contribute their unique strengths to patient care." Senator Thomas Bradley, a physician himself before entering politics, leaned forward. "Dr. Richardson, are you suggesting that neurodivergent individuals might actually have advantages in medical practice?" "I'm not suggesting it," Meyer said. "I'm stating it as fact. The same traits that make autism challenging in social situations can be assets in medical diagnosis. Pattern recognition, attention to detail, the ability to maintain focus on complex problems for extended periods. These are exactly the cognitive skills that make for excellent diagnosticians. We've been treating neurodivergence as a deficit to overcome when we should be recognizing it as a different cognitive style with its own strengths." Dr. Chen, who had also been called to testify, stood as well. "If I may add my perspective as the lead surgeon in Senator Hargrove's case, Dr. Cross's contributions were invaluable. His insistence on checking for multiple aneurysms, his recognition of the vascular Ehlers-Danlos syndrome that complicated Senator Hargrove's recovery, his ability to synthesize complex medical information rapidly, these were all directly attributable to his neurodivergent thinking style. He quite literally saved Senator Hargrove's life by thinking differently." The hearing continued for another 90 minutes with testimony from hospital administrators, other physicians who had worked with Ethan, and advocates for disability rights in medical education. The consensus that emerged was clear. Medicine needed to evolve its understanding of what competence looked like, needed to create space for different kinds of minds, needed to recognize that diversity in cognitive styles led to better patient outcomes. Finally, Senator Whitmore addressed Ethan directly. "Dr. Cross, you've listened to testimony about you for over an hour. Would you like to say anything to this committee?" Ethan stood slowly, his hands gripping the edge of the witness table for stability. Making speeches was not his strength. Talking about himself was uncomfortable. But this mattered, and discomfort had never been a good enough reason not to do something important. "I'm autistic," he began, his voice quiet but steady. "I've always been
autistic. I always will be autistic. It's not something that can be cured or fixed or overcome. It's who I am, how my brain works, how I experience the world." He paused, choosing his words carefully. For a long time, I thought that meant I had to work twice as hard to be half as good. I thought I had to hide the things that made me different, pretend to be neurotypical, mask my true self to be accepted in medicine. And I did that. For years, it was exhausting, it was painful, and it made me a worse doctor because I was spending so much energy pretending to be someone I wasn't that I had less energy for being the doctor I could be. His eyes swept the room, not quite making eye contact with anyone, but acknowledging their presence. Senator Hargrove asked me 3 weeks ago how someone like me could be trusted in a crisis. The answer is simple: the same way anyone is trusted, by being competent, by being trained, by caring about patients and being willing to do
whatever it takes to help them. My autism doesn't interfere with that. In many ways, it enhances it. He took a breath. I see patterns in data that others miss. I remember details from cases years ago that become relevant to current patients. I can focus on a diagnostic problem for hours without distraction when others would have given up. These aren't despite my autism. These are because of it. And medicine needs different kinds of minds, different ways of thinking, because patients are complex and medical problems are complex, and no single cognitive style is optimal for every situation. Ethan's hands relaxed slightly on the table. Mrs. Morrison's death haunts me. It will always haunt me, not because I made a mistake, but because the system failed her. And if this investigation, if my experience, if Senator Hargrove's near-death experience can lead to changes that prevent future deaths, then perhaps some meaning can come from tragedy. He looked at Hargrove. Senator, you questioned whether I could be trusted. I don't blame you for that. Society has taught you that different means less, that neurodivergent means incompetent. But I hope now you understand that different just means different. And sometimes, different is exactly what someone needs. Hargrove nodded, emotion clear on his face. Ethan sat down, his part finished, his truth spoken. The hearing concluded with Senator Whitmore announcing the formation of a task force to review medical education and licensing standards to ensure that neurodivergent individuals were not being unfairly excluded from medical practice, and to develop guidelines for appropriate accommodations. It wasn't perfect. It wouldn't fix everything, but it was a start. And as Ethan left the Senate building, walking out into the afternoon sunshine, he felt something he hadn't felt in years. Hope. Hope that medicine was changing. Hope that future doctors who thought like him wouldn't face the barriers he'd faced. Hope that Patricia Morrison's death and William Hargrove's near death had created momentum for change that would save lives in the future. Different wasn't less. Different was different. And medicine was finally beginning to understand that. 6 months later, Ethan stood in front of a lecture hall filled with first-year medical students at Johns Hopkins School of Medicine. The invitation to speak had come from Dr. Hartman, who had been asked to give the annual lecture on neurodivergence in medicine and had insisted that Ethan deliver it instead. "You're the one who lived it," Hartman had said. "You're the one who proved it. They need to hear it from you." The auditorium held 300 students, their faces young and eager, most of them in their early 20s, at the beginning of their medical journeys. Ethan had been terrified of public speaking for most of his life, but he'd learned that sometimes the important things were terrifying, and you did them anyway. "I'm going to tell you about a patient," Ethan began, his voice amplified by the microphone, but still carrying his characteristic measured cadence. Senator William Hargrove. Many of you probably remember seeing news coverage of his case, but I'm not going to tell you about the medical details, at least not primarily. I'm going to tell you what his case taught me about medicine, about competence, and about the value of different kinds of minds. He clicked to the first slide, which showed a simple question: what makes a good doctor? If you asked most people that question 6 months ago, Ethan continued, they'd give you a list: smart, compassionate, good communicator, calm under pressure, able to connect with patients, all important traits, but they'd also likely describe someone who makes eye contact, who picks up on social cues effortlessly, who navigates the complex social environment of a hospital without difficulty. They'd describe, essentially, a neurotypical person. He clicked to the next slide, which showed statistics on neurodivergent individuals in medicine. Approximately 10 to 20% of the population is neurodivergent. That includes autism, ADHD, dyslexia, and other variations in neurological function. But neurodivergent individuals make up less than 3% of practicing physicians. Why? Not because we're less intelligent, not because we care less about patients, but because medical education and medical practice have been designed around a neurotypical norm, and anyone who deviates from that norm faces barriers at every stage. A hand went up in the audience, a young woman in the third row. Dr. Cross, are you saying medical schools discriminate against neurodivergent applicants? I'm saying the system wasn't designed with us in mind, Ethan replied carefully, which means that even without intentional discrimination, the structure creates barriers. Interviews that heavily weight social performance, clinical rotations that penalize anyone who doesn't naturally excel at small talk, evaluation systems that conflate social ease with clinical competence. These things filter out talented people who would make excellent physicians if given the chance. He clicked to a new slide showing brain scans highlighting different patterns of neural activation. Autistic brains process information differently. We tend to have enhanced pattern recognition, stronger attention to detail, better memory for factual information, and increased ability to systematically analyze complex problems. These are all traits that are valuable in medicine. But we also tend to struggle with things neurotypical people find easy: reading facial expressions, understanding implied communication, navigating social hierarchies, filtering out sensory information. Another student raised his hand. So how do you succeed in medicine with those challenges? Accommodations and self-awareness, Ethan answered. I wear noise-cancelling headphones during breaks because the ambient noise in hospitals is overwhelming for me. I communicate better through written notes for complex information than through verbal conversations alone. I need clear, direct communication rather than hints or implications. These are small adjustments that allow me to function at my highest level. And more importantly, I've learned to recognize my strengths and position myself to use them. He shared the story of Senator Hargrove then, the hearing, the accusations, the collapse, the diagnosis of dual aneurysms that other physicians had missed. He described his thought process, the pattern recognition that had allowed him to connect symptoms that seemed unrelated, the systematic analysis that had revealed the vascular Ehlers-Danlos syndrome, complicating the recovery. I didn't save Senator Hargrove's life despite being autistic, Ethan emphasized. I saved his life because I'm autistic, because my brain naturally does things that are valuable in diagnosis, because I see patterns others miss, because I can maintain hyperfocus on complex problems when others would be distracted. These traits are strengths, not weaknesses, when applied to medicine. He paused, looking out at the sea of faces. But here's what I want you to understand. I'm not special. I'm not a savant or a genius or some kind of medical superhero. I'm a doctor who happens to be autistic, and the autistic part gives me some advantages and some disadvantages, just like being neurotypical gives you some advantages and some disadvantages. Different cognitive styles are just that, different. Not better or worse, just different. And medicine needs cognitive diversity because patients are diverse and medical problems are diverse. A new slide appeared showing recommendations for inclusive medical education. If you become physicians, you'll work alongside neurodivergent colleagues. Maybe you already are neurodivergent yourself and haven't realized it yet. Either way, I want you to understand what inclusive medicine looks like. He went through the list: flexible communication styles, sensory accommodations, clear expectations, evaluation based on clinical competence rather than social performance, recognition that different doesn't mean deficient. The lecture continued for another 30 minutes, with Ethan fielding Questions about specific scenarios, about how to advocate for accommodations, about how to recognize unintentional bias in medical systems. As the session ended and students began filing out, a young man approached Ethan hesitantly. He was thin, maybe 23, with nervous energy that Ethan recognized. "Dr. Cross, I'm Michael. I'm autistic. I was diagnosed when I was 7. He paused, seeming to gather courage. "I've been terrified about whether I can make it through medical.
School. Whether I'll be able to handle the social aspects, the rotations, the patient interactions. Your lecture. It's the first time someone has told me my autism might actually help me as a doctor, not just be an obstacle to overcome." Ethan looked at Michael, really looked at him, and saw himself 8 years earlier, uncertain and afraid, but determined. "It will be hard," Ethan said honestly. "There will be days when you feel like you don't fit, when the social demands feel
Overwhelming, when you wonder if you made a mistake. But you will also have days when you see something no one else sees, when your different perspective saves a life, when you realize that medicine needs minds like yours." Michael's eyes were bright with emotion. "Thank you. For being visible, for not hiding, for showing people like me that it's possible." "It's more than possible," Ethan said. "It's necessary. Medicine needs you. It needs all of us with all our different ways of thinking. Don't let anyone convince you otherwise." As Michael walked away, Maya Richardson, who had been sitting in the back of the auditorium, approached. "That was powerful, Ethan. You're making a difference." "I'm trying," Ethan said quietly. "For every Michael who comes up to talk to me, there are probably 10 who are too scared or too discouraged or who've already given up. I can't reach them all." "No," Maya agreed, "but you're reaching some. And those some will reach others. That's how change happens." They walked out of the lecture hall together into the corridors of Johns Hopkins, where future physicians studied anatomy and pharmacology and the intricate machinery of human biology. But Ethan hoped that at least a few of them had also learned something else today, that competence came in many forms, that different cognitive styles enriched medicine rather than diminishing it, and that the patients they would one day treat deserved doctors who thought in diverse ways, who saw patterns from multiple angles, who brought their whole selves to the practice of healing. Senator Hargrove had made a full recovery, returning to the Senate with a new passion for healthcare reform and disability rights. He'd kept his promise, becoming an advocate for neurodivergent individuals in medicine and other fields, using his platform to challenge assumptions and change minds. The Patricia Morrison case had led to sweeping reforms in hospital equipment, maintenance, and a national conversation about systemic failures in healthcare. Her death hadn't been in vain. It had sparked changes that would prevent similar tragedies. And Ethan continued working in the emergency department at St. Catherine's, treating patients, teaching residents, and living proof that different minds could not only survive in medicine but excel in it, because at the end of the day, medicine wasn't about conforming to a norm. It was about serving patients with skill, compassion, and the unique gifts each physician brought to the bedside. Senator Hargrove had questioned Ethan's mind, doubted its fitness for the demands of emergency medicine, and then been saved by that very mind, working at its highest capacity. The irony wasn't lost on anyone. But the lesson was profound. Competence doesn't look one way, intelligence doesn't present in one form, and the measure of a physician isn't how well they conform to expectations, but how well they care for the patients who depend on them. Different wasn't less. Different was essential. And medicine was finally, slowly, beginning to understand that truth. Ethan stood at the hospital entrance that evening, watching the sunset paint the sky in shades of orange and purple. His shift was ending. Another day of seeing patterns, making diagnoses, saving lives. Tomorrow, he'd do it again. And the day after that, because this was who he was, Dr. Ethan Cross, emergency physician, autistic, brilliant, dedicated, and exactly the doctor his patients needed. The mind that had been questioned had proven its worth, but more importantly, it had helped change the conversation about what worth looked like, about who deserved to be in medicine, and about the beauty and power of cognitive diversity in healing the human body and soul. If this story moved you, if you see medicine differently now, if you believe in the power of different minds doing extraordinary things, I want you to do 3 things. First, hit that like button so more people can discover this story. Second, drop a comment telling me what you thought. Did Ethan's journey inspire you? Do you see autism differently now? Share your thoughts below. And third, subscribe to this channel and hit that notification bell, because stories like this, stories about brilliant people overcoming impossible odds, stories about human courage and determination, and the power of being true to yourself, that's what we're all about here. Thank you for watching, thank you for caring, and remember, different isn't less. Different is essential.